What do you see as the most common symptoms associated with the range of immune-related adverse effects that occur with immune checkpoint inhibitor therapy? Can you walk us through the differential diagnosis of some of these? The most common things we see are a rash, diarrhea, and generalized fatigue or malaise. And basically, for the rash, it's almost always from the drug, and we will evaluate that. But if it's itchy or growing, we will definitely put people on steroids and hold the checkpoint inhibitor therapy. In terms of the diarrhea, we have to be aware of whether or not the patient had diarrhea beforehand. Is this something new or just a progression of what happened before? Did they eat anything unusual? But most of the time, honestly, the diarrhea is from the checkpoint inhibitor therapy, and then it's important to treat them with steroids as early as possible, because diarrhea is one of those problems that if you're not aggressive with it, people can end up in the hospital being evaluated and treated. Weakness and fatigue can be much more difficult to evaluate because there's so many different things that can be causing that. We'll start with some simple blood tests. A complete metabolic panel, which will give you electrolytes and liver function tests. We will also do thyroid function testing, including TSH, T3, and T4. Finally, we'll examine the adrenal axis with a fasting ACTH and a testosterone level. Any of these things can be off individually or together. And it's just really important to pick up on it, because instituting replacement hormone therapy can really change how people feel. I do want to add that in our experience, it's uncommon in the early stages of evaluating patients to have to include any kind of medical specialist, such as an endocrinologist, gastroenterologist, or pulmonologist. We are able to manage this early evaluation in our practice and move on from there as needed.